Hey, everybody, welcome back to the 50, 40, 90 interview series. I'm Uriah Young, your host. And today I have with us Dr. Tommy Rhee, who is a respected physician specializing in sports medicine and orthopedic care with extensive experience treating athletes at every level of competition. Throughout his career, Dr. Rhee has worked closely with basketball players and other elite athletes, helping them recover from injuries, improve performance, and extend their careers. On today's episode, we will dive into the realities of NBA injuries, the science behind recovery, and what fans often misunderstand about the physical toll of the game. Welcome, Dr. Tommy Rhee.
Hey, thank you very much, man. I'm looking forward to this conversation.
We want to start out with a question related to what inspired you to specialize in sports medicine and working with elite athletes from all different fields. What inspired you?
Well, I'm a kid. I'm athletic. I'm playing sports. And I knew that I wasn't going to be that professional athlete that's going to be playing. I don't have that height. I had the talent. I had the willpower. I had the drive, but didn't have that, like, the physical attributes of that. They say they can't teach you height.
No.
So, so because of that, my dad was a physician, and I grew up in that environment, and I saw how my dad cared for patients, and it just somehow, like, it just bled into me. So I just married the two together, knowing it's sports, doctor, caring. And when you get involved with a little bit more, then you become like, it's almost like self gratifying because you get to see if you're right or wrong by your therapy or treatment by their athletic performance. So if they do very well, you're a contributing factor. If they don't do well, then you better question your therapy and your procedure. So I think that's what really drives me is that really seeing if your system of that advanced therapy, the cutting edge stuff, does it really stick out? Because now these athletes are among the other elite athletes. And then not only the other performance, but it's about recovering and getting back to the 100%. And if I'm part of that world, well, guess what? Then my job is pretty much satisfactory on his level because his performance is better. So that's how I got involved with this stuff.
Yeah, growing up in the environment, your dad being in a medical field, and I can relate. I play sports too, but there comes a time when you have to realize, okay, I don't have those physical attributes. So you find another way to contribute to something that you love. So let's talk about some players that you've worked with, just to get that out the way, because all our listeners are like, who did he work with? Whose knees did he help save, or what injury did he help prevent for certain athletes? So you mentioned some players before they got to the NBA. I'm going to let you explain who those players were.
So some of the big players that I had my hands on were, if you remember, let's see, everybody knows Kevin Love, they
Mhm.
know Westbrook, and then one of my favorite athletes was Ryan Hollins. If you remember that center, big tall guy. He's doing great out there as far as the commentating and stuff. But yeah, those are the kind of athletes I work with. And just like everything else, when you look at sports, every sport has its particular injuries, and then in that sport, in the position, they have their own particular injuries. But basketball in general, it's the typical thing you can think about. It's the knees, it's the back, and it's the ankle. That's where you typically hear the big, constant or the repetitive type of like complaints. When you come to football, now you're looking at like, think about all the athletes that I worked with at the Bucks. Of course, the famous one is, of course, Jameis Winston. Then, it just goes on from there. So I had my hands with those guys. And then Olympic athletes, it just keeps going because once you get in that caliber of athletes, you just kind of like move you from one sport to the other. And then now you're working with this guy and that guy. And then, interesting enough, I worked with WWE. So I was there for a
Oh,
while.
okay.
So you can only imagine what they're like and then their trauma and they've got the most unique injuries. The worst thing about them is they don't have a season, so they're constantly beating themselves
Yeah,
up. So
yeah.
we have athletes in that world from like John Cena, Dave Batista, I guess the show, all these guys. It's just one of those fun things to get involved with. And then again, seeing if your therapy does help them out to get back on their performance level.
One of my favorite films that I never thought I would like, just because I'm not a big wrestling fan. I watched it as a kid, but when I got older, I kind of deviated from that. There was a movie that came out in 2009 or 8 called The Wrestler. Have you seen that movie?
Yeah, yeah, yeah. What's that called? The double ram. Remember the double ram?
Yeah, yeah, The Ram. He
Yeah.
That was a great film, dramatically, the acting and some of the injuries that they would sustain and deliberately put themselves through.
Wrestling is one of those type of sports that you have to start from the very like the beginning of like backyard wrestling. You know, these little garages, warehouse wrestling. When you there's only like two or three people in attendance as you're wrestling.
Hmm.
You have to go through that process. You have to learn how to wrestle, work with other because it's a dance, right? You have to land together. You have to, present yourself like it's real, but it is sort of in itself real because you're throwing yourself around and landing on your body. If you don't land correctly with this other opponent, you're gonna get injured. So that will be showed exactly how these guys go through the wrestling world. And if you stick with it, and you're not injured, you'll get up there as long as you have that personality. That's the biggest thing. Personality,
Yeah,
the physical side, of course,
huge.
and then the ability to deliver a story, the the fighting, the punching, and the kicking, and just really act very like dramatically in the sense that the crowd gets riled up. So
Yeah, once they grab that mic, it's like it's all show at
I'll
that
show.
point. It's like all the action is kind of secondary once they grab the mic, right?
Now, the superstars can do both the athletic and the physical stuff and talk on the mic. That's the best person. So you'll have some guys that are real quiet and they do that silence type of like a role where they're like masked up and they're hiding themselves. Because they don't have that personality, so they kinda say make that, like, mystique kinda guy. Then you have that guy that has no, like, a little bit of a wrestling ability, but he's got a great charisma, he'll do well there. That's what I saw, and that movie portrayed that. You really see it, it's like that really dark side of wrestling, and it's just like that. You'll see someone go up to the top of the WWE, and something
Mhm.
happens, and they get knocked down. When they get knocked down, they get all the way back into that environment of, like, that warehouse wrestling, small venues, maybe one, two people, maybe 30 the best. And then you just constantly understand that this is part of the stepping stones.
So you mentioned John Cena, who was able to navigate both the wrestling world and the acting world. My next question relates to basketball, and I mentioned John Cena because he's known for wearing NBA jerseys in the ring. So back to NBA. The question I have for you has to do with trends that have been happening within the NBA. In your opinion, have injuries in the NBA changed over the last 20 years? If so, what trends do you notice?
That's an interesting question because the trend has been twofold. So the training has been picking up. So these athletes are being like better performance, right? Better performance, better like anatomy as far as their one max rep and their ability to outdo the old past kind of like performance of like vertical jumps and stuff. Now, before it was mostly talent. Talent took you to the level of the NBA. Now you can drive yourself and train that way. The problem is that you have to start understanding that there is that fine line between exercising, fitness, performance, and working out. And the second side is the recovery. You've got to get the recovery intact because sometimes when you work out too far and too fast into the world of not, overtraining and you're not getting that recovery, you're starting to get that chronic injury. You're starting to get the little ache and that ache turns into something bad. And all of a sudden it just takes a matter of just, those little tendons that actually hold on and they get compromised, especially the Achilles tendon or patella tendon. So that's the biggest thing, right? You get the Achilles tendonitis and the jumper's knee, that patella tendon. Those two things are like the worst scenario for basketball players. Once they start getting injured in that area, you've got to address it quick because if you don't address it, it's going to become a chronic situation where it gets worse and worse, and then it would rupture. It's going to do something.
Mm.
So I think it's because of the performance and training and not really recognizing that side of the recovery. That's what I feel. In the old days, it was just basically just talent, just really good talent, and then they just took themselves in the NBA.
So the game, according to certain NBA players who are saying that the game is faster, LeBron James famously has been on podcasts mentioning how things have changed in the past, let's say 15 to 20 years. Because the game is faster, there's more possessions. They're shooting threes earlier into the shot clock. They're getting up and down the court a lot quicker. Do you think that this change of pace in the NBA has increased injury risk among the athletes on the floor?
Absolutely. I mean, don't forget, people think there's just one basketball game, like a week. There's multiple games. I mean, these things go on and on. So
Mm.
Remember, the second part is, you push yourself, you're maximizing your output and you're beating yourself up. Well, believe it or not, you're breaking down muscle tissue, you're breaking down tendons and ligaments, and you just have to have the ability to recover. Well, if you have the back to back game, well, here you go. You're not 100%. So now you're on willpower. Now you're talking about what this is all about, right? So you have a larger body, your ability to run, and you're really taxing that tendon out and those muscles. And now you don't have the ability to recover. So, because of that repetitive movement and just not having that recovery time, you're going to have something come down the line with a chronic injury that turns into acute, and pretty soon it's going to be like a season ending or something that's really going to disturb your whole career. So, absolutely, man, that's like everything in general, like not just basketball, football, baseball. Athletes are becoming bigger and stronger, and their performance is great. You just got to be careful that there should be a component of the recovery. So that's the big thing about that.
Let's talk about the Achilles injury. For basketball fans, it's pretty much clockwork that every season one of their players from any franchise or their favorite team comes down with an Achilles injury. For the people who are not familiar with the anatomy of the body and that part of the foot, can you explain why the Achilles injury can be so devastating for basketball players?
Yeah, I mean, if some of you guys don't know where the Achilles tendon is, it's just take a look at your ankle, and behind the ankle, right lower is the heel bone, and that heel bone has that little attachment, and you go up the back of your ankle, and there's that long string called a tendon, and that's the Achilles tendon, and it attaches to your calf muscles. So there's four calf muscles in there. There's like the medial lateral or the gastroc and the soleus muscle, and they kind of make up those big muscles turn into that tendon that attaches into your heel bone, your calcaneus. So that particular area, basketball players have longer ones, some have shorter ones. So when you jump, when you do anything, that's the first activations happening right there. So, and here's the thing that people think that the injury starts with the jumping, like the getting off the ground. Well, not so much. It's really about the landing. It's really about what they call the eccentric component. When you jump and you come down, that's a lot of load. That's not your body weight. That's your body weight plus a lot of things going on with the force, and you're trying to fight it so your heel doesn't slam. Well, you do that over a period of time, you're basically trying to rip it apart. And then, thank God you're strong enough to hold it. But here's the thing. Again, if you have a slight injury that happened maybe like 2 weeks ago, but you're still playing. Well, that little 1, 2 kind of like fibers become 7, 8, 10. Now you're multiplying because you're not given that ability to rest. So that's why when you look at Achilles tendon and someone gets injured, you're talking about the whole entire leg because that is so close to your foundation, your foot. Now, if you have an injury in your hip way up higher, you can kind of compensate by shutting down the hip, but still use your knee and your ankle. When it comes to your Achilles and the ankle component, I mean, you're pretty much, you can't do nothing. I mean, even
Mm.
walking irritates it. So that's why it's very important for basketball players and anybody in general. When the Achilles tendon is, injured, it's difficult to perform.
Yeah, it sounds painful too. A lot of players describe that in your point about it's not about the jump, it's the land or getting to the point of the jump. They say they hear a pop. And I've never had one. I've never had that type of injury, so I can't relate. I don't know, but it sounds pretty painful.
Yeah. I mean, I think the pain is there no matter what. But I think it's the shock of hearing something that almost like a rubber band, like rubber band snaps. And you see videos out there of that type of Achilles rupture. And then you see it with Aaron Rodgers. You can see it on some videos where in fact, there's a video out there of a female doing some type of sprinting. And she's going, it's like one of those suicides. You go there and back, there and back. And when she came back, she stopped with her foot, and when she stopped, she planted her toe down, and she pushed off, and when she planted, you saw her calf kinda like just like, boom, and you can see the spring and that little coiling back of that tendon into the calf
Mm,
muscle, and just like anything else, I think that's the big shock is that the pain there, but it's just the shock of that pop sound and the muscles coiling up and cramping up because it doesn't have any anchor point anymore. So it's pretty invasive in the sense that it shocks your mind.
yeah. Let's talk about another injury that is part of the NBA or just basketball itself. ACL injuries. We know how devastating the injuries can be. In your opinion, What advances in medicine have made it possible for players to actually come back stronger after sustaining an ACL injury?
Right. So here's a funny thing with ACL. I've come across athletes that don't have an ACL. They weren't born with one or they had a rupture when they were a kid, but they still go out there and perform. So the ACL is kind of one of those. So there's four ligaments in the knee. So there's one, the outside, they call them the collaterals, and the inside, the cruciates. So the anterior cruciate ligament, it prevents the actual, that little bone, the shin bone called tibia, to like displace forward anterior. So there's a ligament that crosses over from the thigh bone, the femur, into the tibia, and it prevents it from that kind of glide. Also,
Mm,
it prevents it from when you do rotation on that one leg. It helps you kind of secure that kind of like extension or the rotation, and then it limits you. So when your agility is like very pronounced and you're very like mobile, well, the ACL helps you out because you're going to be twisting and turning and landing in certain angles that you shouldn't. So when you hear about these basketball players that are coming back faster and stronger, they're not really 100% back. They are just back in the sense of playing basketball. I can do a layup. I'm not going to do any kind of crazy like 360 with a flying self. They're not going to get that aggressive, but they're going to go play basketball. It's going to take time. You have to understand that when there's an ACL injury and you need it for your performance in the past, it's going to take time to get that to really mend in and hold tight. Because this ACL, when you look at that ligament, the ligament is either attached or it's used by some type of like cadaver or your own tendon from like muscle, like a patella tendon or the bicep femoris. When they anchor down, or they thread it through the bone and they make a little knot so it just has it like an anchor and it tighten it down tight. Well, you want the bone to fuse around that, either that screw or that knot become one. That takes time. So
mm.
you need everything you can to speed up that process. And when you come back and you see it coming back fast, yeah, you can come back fast, but you're not going to be at your 100% like what you used to really be in an agility role for another year.
Wow. What I took away from that is I didn't know that you could be born without that ligament or the ACL, and the whole idea of how everything moves in that part of your body as you're shifting and accelerating. It's absolutely fascinating. Now, I would love for you to elaborate on this because I'm an average fan. I love sports. I've been watching sports since I was a kid, but from your lens as a doctor, you will notice things that the average fan will not when it comes to players on the field or on the court. So when you watch, let's stick with basketball, right? You're watching basketball, you're watching KD, you're watching Klay Thompson, you're watching whatever player that may have sustained a serious injury at some point in their career. When you watch those players, what are some things that you notice about how those players move that the average fan might miss?
Mm. Was the biggest the okay, so you wanna think, like, you wanna see them before they had that maybe, like, an injury, right? So you wanna see their normal performance. You wanna have a baseline. So then, from there, you start looking at him in the present time, and you're seeing how he moves. A lot of, like, favoring, if you have a right injury, like your knee or your ankle, you'll favor the right and move more to your left. You don't wanna push off. And it's the way they jump off. If you have that injury on the right, they'll usually use their right because the right's a more powerful leg and they use it and they abused it and that's why it's injured. So now they have to start jumping up the left. When you see somebody jump with the opposite leg, you can tell right away. You can tell that why is he acting weird? He usually jumps with a little more force and a little more confidence. This is a little different. And then when he lands, the right away you're going to start seeing him look down. When he looks down, you know he's going to protect
Mm,
himself because he's afraid that if he lands on that ankle or somebody's foot, he's going to roll it. So you'll see him look down. So when I see things that with an athlete, and I try to figure things out, you want to see the before and then where he's at now. And then there's little telltale signs. Mostly like they really like to favor that one side, because of the injury to go the other side.
okay. Let's go into young players today. And I'm not just talking college or young NBA rookies. Let's look at younger basketball players at the AAU level. We're talking 12, 13, 14 years old. In your opinion, do you think these young players today are higher at risk of injuries because of the year round play of AAU schedules?
Yeah. So I get to see every level from the professional world all the way down to AAU. So here's the thing about that age group. That age group, like 10, 12. Right now, I've got a couple kids here that have this thing called Oscar slaughters. So Oscar slaughters is that we have the ability to grow before puberty, before we start, hitting that, right? And then we'll
Mm,
grow after that. But we have these things called growth plates. And growth plates are basically when you look at your bone, you've got that little head, you got the neck of the bone, and you got this long shaft. But typically, right at the neck area of the bone, the tibia bone, like in your shin bone, there's going to be a space, like a gap. I call it a growth plate. And it hasn't fused because that's where the growth is occurring. Consequently, you have a tendon, your quad, your patella, and then that patella tendon. Well, it attaches right at that growth plate. So now you have that tendon attaching to the part of your shin that has a growth plate, and that's the weakest part. So then when you have these kids that are going through a growth spurt, but they're constantly jumping, well, their bones are growing, but the muscle is not growing in same like ratio. So let's say you grow 4 inches, but the muscle hasn't grown that fast yet. So then when you jump, the muscle is shorter, so it's trying to pull that piece of bone off of that shin bone because of that growth
mm,
plate. So you see that more pronounced now. And then the worst thing about it, these kids don't want to stop. So they have to constantly keep jumping and moving on it. So
mm.
you start getting that little bump. You see these tall guys that have a big bump right underneath their kneecap. Well, that's from their experience with Auschwitz slaughters. So we're seeing more pronounced of that type of like pain.
Wow, that's rough for a young person because all they hear is, the more you practice, the better you'll get. But if they're growing at a point where the ratio of their muscle growth and their growth plates they're growing, it kind of contradicts, the whole idea of getting better by playing more. But let's go to some advice that you would give a young athlete who has aspirations of making it into the professional league, whether it's in Europe or even the NBA. What do you think young people can do to protect their bodies long term?
Stretch, flexibility. You've got
Mm,
to get your flexibility. A lot of my basketball guys are not flexible. A lot of them. So I have
mm.
this one guy. He just I don't want to say his name yet, but he got picked up by a big school and did very well in the high school world. I mean, he's in AAU world and all that stuff. But when he first came to me, he had the bilateral, both knees kind of pain, ankles, the typical basketball kind of like overuse kind of syndrome. So with that, when you test him out, you see the inflexibility. You see the quad, you see the hamstring, you see the low back. It's not flexible. So that's what the object is get him to get normal range of motion. Tall guys, they're tall, they can get away with things. But when you want to prevent that chronic injury, you've got to increase flexibility. And this is simple things, just hamstring stretch, quad, and really go into the quad stretch because that's what you want to lengthen. You want to lengthen that quad muscle so it takes the pressure off your knees. And that's the biggest thing. So with him, we really dedicated our time with that patella tendon, the quad muscles, his hamstrings, glutes. And then the best thing about it, his injuries start slowing down. Now his performance picks up. So it's a great exchange right now. So once you start reducing pain, now your performance gets increased because you're able to do things. So now he's saying that wow, I can have better lateral movement, my vertical's better, and I have a better sense of confidence. Not so much like, oh, I'm gonna be injured, I'm feeling this pain, I have to inhibit my action. So flexibility is very important.
Yes, flexibility. I have someone on the East Coast near me that emphasizes stretching for basketball players. So I'll share that information with you later. Really, really great show that he has. His name is Martin Soares. But let's move on to the final question of the interview, and it has to do with a despised term when it comes to basketball fans, especially if you have favorite players or you have a team that is coming into town and maybe they don't play because of, get ready, load management. So, Dr. Rhee, can you elaborate on this whole idea of load management and if it actually, in your opinion, prevents injuries? Or is it something that's still debated in sports medicine?
I think it's just another terminology. He needs more rest, right? I mean, you're just taking the pressure off of him, and it's like reinventing the wheel. You're just saying, hey, he needs more rest.
Hmm.
I think the reason why people they have to understand. Now, you're playing basketball 4 games a week, 3 games a week, and you're beating yourself up. And when you have an injury, a lot of athletes and teams don't want to report these things. They want to say, okay, let's keep it quiet. We don't want to, explain to other teams that we have a weakness because, other teams will kind of work around that weakness. "All right, go after that player, but, he's got a bad ankle." So they want to report it. So then they basically say that, that easier terminology. So I know it's tough for fans because you're waiting for a superstar to come in town and play, and all of a sudden he sits out. It's the curse. But you have to understand, if that's your favorite team, you got to understand that he's trying to last for that season. He wants to go in the playoffs. He needs them during that process. So that's the tough thing. I know it's the most annoying thing to hear. But
Mm.
you just imagine like that basketball season getting longer and longer, and they're beating themselves up. And you just need a little downtime. Imagine if like football played that many games in a week. Those guys, those 53 roster would be up to like 180
It
because
wouldn't last. Yeah.
no, you wouldn't last. So basketball is easier, but still hard. It's a tougher environment because it's getting physical. You're outperforming, and then again, you just need that recovery. And when you get the recovery, then you see the performance increase.
Yeah, I think because of unfortunately, because of the money that athletes make now, the expectation is that they should just play through pain.
Hmm.
And the reality is, even though they're superstars and they can do what the average person cannot on the field or on the court, they're human and their bodies are are not impenetrable. So that's just something that's a fine line that I think fans need to gain perspective in. Because of your information you shared, it offers that perspective. So thank you for joining us in this episode, Dr. Rhee. Can you please tell all of our followers and listeners where they can find your information, website, social media? Go ahead and give yourself a plug.
Yeah. Go ahead to my website, which is called Regen, RheeGen.com. And you can learn about topical stem cell cream. And then if you have questions, there's an info button. Go ahead and hit and ask me a question. And I have a book out there, The Future of Regenerative Medicine on Amazon. You can go get that book there. And then, of course, just Google me and you'll see me everywhere out there. So, yeah, any questions, shoot me a message.
Dr. Rhee. Rhee. And that is it for this episode of the 50, 40, 90 interview series. But on behalf of Dr. Rhee, I am Uriah Young. Thanks for listening in. We'll see you next time.